I always talk about how you can use various tools more effectively in general practice. Well, in this episode, I'm really happy to be joined by one of our EGP learners who's going to show us how to get the most out of Excel and in such a way that this can streamline and basically make your practice run so much better with a tool, Excel, but more effectively with the skills and the ability to use that effectively to manage your practice population and tech enhance your primary care and learning. Hello, EGP learners, and welcome to this episode where we're going to be covering how to get the most out of Excel in such a way that, trust me, when I saw this, I was blown away. And I said to Davinia, I want you on the channel. I want to show everybody else what you can do with this tool, and more importantly, how she has innovated it to make it so specifically useful for general practice. So I'm really going to geek out on this session, so apologies on that. But just first of all, I want to say hi to Davinia. How are you doing there?
I'm all right. Thank you very much for having me on the channel.
Definitely. So do you want to introduce yourself first of all? Because I'm probably going to make a mash of it and things, but absolutely, I think people need to know what you've been up to as well.
I'm Davinia. I'm a GP partner in Northamptonshire, partner almost now for double digits, and I'm an LMC representative. Since our practice and ICB has moved over to Microsoft 365, I've been looking at the functionality of Excel and seeing what we can do to try and maximise its use in primary care, alongside with Power Automate, Power Query, and have started to look at where the problems are recurring and the questions are recurring, and just really looking at different ways of managing the problems that arise in my practice. So if this is helpful for other people out there, that's great.
Definitely. And I think it will be absolutely to many people. And, you know, particularly over the past few months, I've been at various speak opportunities. I've said to people, use the most out of the tools that you have. So as Davinia mentioned, all of us across general practice have access to the N365 tool set. But what we do with it is just scratching the surface for many of us. Well, in this episode, we're going to go through what you can do when you combine Excel with Power BI and all the other parts of it and things. But more importantly, for those of you thinking, oh, good Lord, he's already confused me, I don't want to listen to this. Actually, Davinia has done all the work for you and going to give you the ability to do that either yourself, or if you need her help to do it, do that so much more effectively. And this is crazy amazing stuff. I really love it. Really excited to show you this. So I think we're going to get started straight away. So do you mind sharing the screen and stuff? And then whilst Davinia's doing that, I'm just going to cover what you're going to see in this. So we're going to show you an appointment capacity calculator, an enhanced version of that that's going to make it even more detailed, a nurse capacity and skill mix rotor, a room rotor, a GP trainee calculator for their rotors and stuff, an on-call rotor calculator, enhanced service contracts calculator to figure out how much she's spending for these, and a PCN extended service calculator. And all of that is not even scratching the surface of what she's working on and stuff. So we're going to basically cover loads and loads of stuff and things. So let's get cracking with that. So let's take a look at this then. So this is the appointment capacity calculator. Am I right?
Yeah, this is the appointment capacity calculator, and this really started because we've got a changing partnership, few retirements, and you know, trying to make sure that people can have annual leave and that there's adequate service provision left behind, and so that you don't end up in that scenario where you know, it's February half term and the guys that have got kids want to be off, but the guys that don't have kids also want to be off because they know it'll be horrendous. So it's just sort of having that foresight with the way that you plan your practice annual leave rules, and making sure that people are able to have their leave and, you know, be well rested. So with every spreadsheet, I always start just by writing some rules for myself so I remember how to use them all, because as time goes on, everything develops very quickly. And so there's always a sheet just with data validation so that any information that needs to be pulled through is the same every time that it's pulled through. And then the actual calculator itself is just here and shouldn't look too threatening. It is just a simple table that we can fill in as we go along, and then I can show you the calculations at the bottom of the spreadsheet down here. So what we have is, say, a practice with 6 partners, 7 salaried GPs, 5 nurse practitioners, paramedic, physio, pharmacist, GP registrar, and then we've got our GP extended access appointments down at the bottom here. And if you were to just go through and populate the spreadsheet with the appointments provided by each partner each day, let's just say that everybody's seeing 10 appointments a day, and we've got this GP partner working 5 days a week. We've got partner 2 who's doing 12 appointments in the morning, 12 appointments on a Tuesday morning, 12 appointments on a Wednesday morning, 12 appointments on a Thursday morning, and 12 appointments on a Friday morning. We've got GP partner 3 who's working 12 appointments on a Monday morning and Monday afternoon. They're working a Tuesday and a Thursday, and we'll put them down at 12 appointments. Partner number 4 can be at 12 appointments on a Monday. Everyone's in on a Monday because it's the busiest day of the week. Then they're in on a Wednesday and a Friday as well. And then we've got partner number 5 who's working Monday again, and working Thursday and Friday. And as you can see in the total column, the spreadsheet will add up the number of appointments provided by each of those clinicians for the whole week. Just put a partner in here at 12 sessions and, 12 sessions there, but you can see all of the total rows start to add up. And then if we do the same with sort of salaried GPs, and I'm just writing in random numbers here because you can just play around with it and it'll automatically update. We can have our MPs in throughout the week as well. And I'll just take that across, and then it'll automatically add up the appointment provision provided by each of the MPs. And then there's a total row at the bottom there, sorry, to the side, that just shows how many appointments are provided. And then at the bottom here, you have a total number of appointments provided for the week, alongside having the total number of appointments for the morning session, the afternoon session throughout the week, and then the total number of appointments provided for Monday, Tuesday, Wednesday, Thursday, Friday. Obviously, practices are now doing GP extended access, so we can put in 20 appointments for GP extended access for the morning and the afternoon on the Saturday. And as you can see, it dynamically updates, and then you've got your total number of appointments provided for the week. If you wanted to use that just to find out how many members of staff you needed and the appointment provision through the week, that's absolutely fine. There is the option as well down here. I've got a bank holiday calculator. So we know that most of the bank holidays fall on a Monday, but they do fall through other days throughout the year. But if we were to say that Monday was a bank holiday, the spreadsheet will automatically clear any service appointments for the Monday here, and it will come off the total capacity over here. And so obviously Christmas is a Wednesday this year, isn't it?
Yep.
And Wednesday, Thursday, you've got the bank holidays. You can see that the appointment provision for those 2 bank holidays is taken out. So if there was partners that were saying, I want to go on leave, if you've got your MPs wanting to take leave as well, you can now work out how many appointments you are providing per week. There is a larger graphic just there if you wanted to. So partner number 1, if they're on leave, it will automatically pull through the number of appointments partner number 1 provides, partner number 2 provides, MP number 1 provides, and then we can have MP number 2 over here also being on leave. Also being on leave, there we go. And then this is the total number of appointments that you would lose with those people going on annual leave. If you've got any staff sickness, this will automatically also clear the number and pull through the number of appointments provided by that clinician. And then we've got the protected time calculator. So in everybody's practice, I'm sure we have some protected time to be able to deliver a GP admin, PCN admin, child and safeguard admin, the MDTs that we need to provide for. There's also a lot of training and debriefing that we do now, and that can pull clinicians out of activity. So you just generate the list for your practice and the kind of protected time slots that you have within your practice, and then just write in this column here the number of appointments that you would lose for that. So I've just put in randomly 25 appointments for a PLT, 10 appointments for GP admin, and just taken that figure all the way down. And if there is a PLT that week, you just click on yes over here, and you can see that dynamically the appointment provision is calculated based on the protected time that you have for each of those areas. So dynamically, you can see, okay, if this is a low capacity week, which bits of protected time we maybe need to push to another week. So it just gives you a chance to plan for your practice and see how many people you can have away, what protected time you can have, and see really sort of what the provision of appointments will be, whether you need locums or whether sort of you need to limit the number of people that are away.
Definitely agree with that. Yeah, and I think the key thing with that is, like you say, not only does it help you capture the amount of capacity you've got within your practice, but then in addition to that, it will let you scope out what you potentially need moving forward, so you can preemptively get the teams in that you need, or you can recognize this is going to be a pinch week. This is actually not going to be as bad as we thought it was going to be. Actually, we should be all right. And do we need to have a look at that extra spend? And many people are probably thinking that with obviously increased cost pressures come to general practice. In terms, you can probably tell when we filmed this and stuff. But those are the key data sets that you're going to have that information, particularly when you couple that, I guess, with your your demand data through things like obviously telephony systems, your existing, online consultation platforms, the data you're getting in terms of what you need. So matching those two up will be really powerful, I think, for many practices and really useful for them to do. Sorry, you're going to say something else, Davinia?
I was just going to say, well, following on from that one, I started to think about your infographic of the hidden workload in general practice. And I thought it would be quite useful for practices to also have the ability to know, we know what the additional workload is, but we don't realise how much time we need to give to it. We just kind of squeeze it in. General practice is really good at just working and working. This is the updated version of that original appointments capacity calculator in case people were wanting half days off, or you've got clinicians working half days, and you can pick out the bank holiday, the annual leave, the sickness, the protected time, but also you can put in down here whether you want a partner to go off for a half day, or a salary GP, or a physio, or an MP, and that will automatically take off the weekly appointments. So if I just go up here and put partner number 1 in for 10 appointments on the Monday, and they wanted to have Monday morning off here, the calculator would automatically take off their 10 appointments. And then if there was also some protected time that needed to go through, you can see how you can select the time that need the protected time slots that they need, and the capacity calculator will calculate how many appointments you are losing a week for that protected time. And this is a very poor practice because they're at minus 65 appointments already. But then you can calculate as well, if you want to, how many appointments you would need weekly, fortnightly, and monthly, and then it just allows you to see the amount of time that's needed to be dedicated through for that protected time, and the additional roles that we need to do away from just face-to-face consultations.
Cool. So that's the appointment capacity.
That spreadsheet.
Yep. So next we've got one that looks at nursing capacity.
So the way that this spreadsheet works, again, there's instructions on the front worksheet. You've got your data validation tables, which show the roles within the nursing team, the staff names of your nursing team, and these are dynamic, so that even if you were to add in more people underneath, it would update in the actual worksheet. We've got up to 4 sites here. I know some practices are quite large, some might just have 1 or 2 sites, some might just have a branch surgery, but you can select and delete the number of sites. And then we've got the number of clinics that are provided. injection clinics, health checks. You can pick the role of the team member, what they're doing. So if you've got your nurse manager and they're just doing management that day, you can pull through and leave this blank, but know that they're in and there is some hours there for, bodies being at each site. Pick the name of the clinician and then pick the site that they're at. And then for each clinic, so for nurse 1 here, who's our nurse manager, they're doing 10 appointments on a Monday morning for smears, 10 appointments on a Monday afternoon for COPD. And then we'll pick one of our nurses over here I've not actually got I've not actually put a nurse on there. So let me just put a nurse in there and go back to nurse clinic calculator, and then we'll have a nurse appear there. We'll pick her name as being nurse number 2. She can be at site number 2, and then she can do a Monday morning of general nursing and then a Monday afternoon of general nursing. But then nurse 2 can be at site 1 the next day and then do a morning of leg ulcers, and then on the afternoon at site number 1 they can do an afternoon of diabetes, seeing 10 patients. To the right of the spreadsheet you will get a total count for the number of patients seen, and you will get a clinic count for each of the type of clinics that are being offered. And that's really important because I'm going to scroll out now and just go down to the bottom of the spreadsheet. So for each member of staff, you have to put which site they're at each day, on the type of clinic that they're doing and the number of appointments. But again, the spreadsheet will calculate your appointment provision on a Monday, Tuesday, Wednesday, Thursday. There's no Saturday on here. That's in a separate spreadsheet. When I showed this to my rota lead, she said, "Oh, I want a bank holiday calculator." So I added in a bank holiday calculator here, and you can see that if Monday becomes a bank holiday, the appointments are zeroed out for whichever day of the week you pick. So if we were to pick a Tuesday, it's a bank holiday, it goes to 0 as well. And then if you have somebody on sick leave as well for a period of time, or they're on annual leave, you can just click that they're on annual leave up here. And then what will happen is further down the table, you will see that nurse 1's on annual leave, and she was doing smear and clinics for us, but it will take her out of the appointment provision for providing those smear clinics. If I put her back to not being on leave, it just shows that she's back providing 10 smear appointments at site 1 throughout the week. And then there's a dynamic array here that looks at the appointments provided per week and then the clinics provided per week. And I know that sort of nursing staff are absolutely brilliant and they train up in loads of things and they've got their skills. As a practice, you'd want to ensure that you were allowing them to use all of their skills so that they could stay with you for longer and feel happier coming in to do the job. So there's actually a dynamic array here that just runs through the different types of specialist areas that each nurse provides, and you can check that against their skills matrix and make sure that they're having the opportunity to provide as much as they can do. So I'll just give you an example of that. So we've got nurse 2's doing asthma, diabetes, general nursing and leg ulcer. If I scroll back up to the top and just change nurse 2 to nurse 1, all the way through, you will see that the spreadsheet at the bottom will update and nurse 2 disappears off here and her specialist areas aren't on there anymore, but we can put her back on and she will reappear, nurse 2, and we're only using her for stage 1 long-term conditions reviews. So it's dynamic and it updates depending on the information that's fed in. What I would say is that the information that's fed in early on these spreadsheets up here is so important. All of the dynamic arrays will work, but it's the information that you feed into a spreadsheet.
Mm-hmm. So we've had a look at the nursing rotor. Let's have a look at the room rotor. Now, this I think is amazing because this is going to solve problems for so many practices. that have this issue with the state, as well as where to put people, which is, I can assure you, many people have this issue. Show us the room rotor for us.
So this room rotor is, I've got the instructions on here because I always forget, there's some formatting on here. So one of the issues with room rotors is sort of, and across split sites is, have you allocated the same clinician twice, or is the same room being taken up twice? So anything that comes up in red indicates that a room has been allocated more than once. Anything that's yellow shows that a clinician's been allocated more than once. We've got the data validation tables, as we always have, with the roles within the team, the staff names, the sites, and the room numbers that you could have at either site. It's best just to go with your largest size practice and put in the most number of rooms that you've got there. Then I did do two versions of this. I'm going to show you the dynamic room rotor, which is much more awesome, which just shows an updated clinician list at each site throughout the week. So if we were to pick doctor number 1, who's a partner, they're at site 1, let's put them in room 1. And then on a Monday morning, we'll put them seeing 10 patients, and we'll take that along for the rest of the week. If we were then to have doctor number 2, who's a new salary that's just started with us, and we want them to be in room number 1 as well, we can then put them in for 10 appointments on a Monday, and then 10 appointments on a Monday afternoon. But automatically the spreadsheet will show you that you've allocated the same room twice. So you need to just allocate them to a different room. And this can happen with every clinician that you've got. So we can pick another partner here, and then we can pick site number 2 here, and put them in at room number 1, and give them 10 appointments in the morning, 10 appointments in the afternoon. But then we can pick doctor number 3 again and put them in for GP extended access, but we're going to put them in at site 2 again, and we won't allocate a room number, but we will put them in for 10 appointments here, and then another 10 appointments here. And you can see that you've allocated the same doctor twice. And so the spreadsheet will say you've got to come back to it. So they're quite hazard colours to bring your attention to the fact that there's something there that needs your attention. This spreadsheet can also calculate the capacity that you have throughout the week. So you've got your number of appointments provided by each clinician in the column on the right-hand side. And then if we scroll down the bottom, you get your total number of appointments provided on a Monday morning, Monday afternoon, Tuesday morning, Tuesday afternoon, and so on throughout the week. And then what you will also see is that there is a dynamic array that builds to show the clinicians at site number 1 and the clinicians at site number 2 and the number of appointments that are provided. So if you were looking to provide more appointments at one site than another, and you have a percentage split, you can use this to work that out. Or if you wanted to have an equal provision of appointments, you can use these arrays to make sure that you've got an equal number of clinicians at each site. If this spreadsheet got too much for you and you didn't want to be scrolling up or down, you can click on each of the roles on this slicer, and it will give you the number of appointments provided by clinicians. So we've got partners on there, we've got GP extended access on there, we've not got any HCAs, so it'll be blanked out, but you can see how the spreadsheet will update depending on the roles. So if you wanted to see, actually, I'm not interested in what's going on at each site, I just want to know the number of paramedic sessions that we have today, you can just click on the paramedic button and it will tell you how many paramedic appointments you're providing throughout the week overall at all of your sites. So that I thought was pretty cool.
Definitely. And we're not even halfway through it. So let's go on to the next one, which for all the GP trainers out there, this one is going to be an absolute godsend in my mind. So it's a GP Trainee Rotor calculator. So Vinny's going to bring this on, but this basically helps you sort out your clinics for your trainees in terms of what they're doing, how much they're doing, whether it's right, whether it's wrong, all that kind of, it's just awesome. So take it away.
So we've got the instructions starting off here as well. So we've got the GP Registrar Clinic Builder instructions. Now, you are a trainer, so I'll just ask you to give me some information here. We've got trainee number Dr. 16. They've started on the 31st of August with you. They're ST1. They've got a training number. Their deanery is Springfield. And what proportion of full-time equivalent are they?
Let's go for 70%.
Okay, so we'll do 70% full-time equivalent. So they should be doing 28 hours per week. Then we've got the number of appointments, the different types of appointments that they could provide per week, and the number of the appointment length for each of those appointment slot types. And so if we say for admin for a GP registrar is 10 minutes, their break is 20 minutes, or they can have a 20-minute or a 30-minute break. Telephone consultations, 20 minutes.
Yeah, okay, that'd be, yeah.
Okay, yeah, visits, they get half an hour. Debrief will just be 40 minutes. And then, so you work out sort of the appointment type and the appointment length with them, and then move over to the clinic builder. So most trainees, I've got this trainee starting at 10 o'clock, but we can change this to 8 o'clock just here. And what it will do is the spreadsheet will automatically update depending on the type of appointment that they have to start off with. So we could start them off on the day with having a break, and the first appointment time doesn't change. It's the cell below on the corresponding column that changes. So they have a break for 20 minutes. They can see their first face-to-face appointment, then they can see another face-to-face appointment, another face-to-face appointment, a couple of telephone calls, then have a debrief. They can have a break for 30 minutes, and then they can have another break for 30 minutes. So they get their lunch break in for an hour, and then there can be a period of self-study, or they can have clinical supervision, which goes on and gives them an end time of 2 o'clock. The toolbars up at the top remind you of the number of hours they should be doing a week. At the moment, we've got them scheduled in for 10 hours in total on the Monday and Tuesday. They've got 6 hours of clinical and admin, and they've got 6 hours for educational and 2 hours for break. So I know the rules change depending on how many hours each GP registrar works and their work pattern. But this is just something, as you're building that, you can play around with it and give them more face-to-face, take out the debriefs. In fact, we could just run this trainee all day and have a debrief session. So they're working a half day, but you can see the split that then happens with the appointment provision and their rest time as well. And their break time goes up. So we can put more face-to-face in here. And then what it will do is create a summary of pulling through the data already of what they've got, what they should be providing, the total number of hours that they are actually in training for, the breakdown and the split of the minutes to the breaks, clinical admin and educational sessions. And then there's a nice little pie chart there that just shows visually, okay, we're about 50-50 here, we need to change that ratio there. And then this pie chart will take out the breaks and just show the appointment provision for clinical and admin time versus educational time as well. And then if you wanted to take it one step further and prove how many appointments they've been seeing and the type of experience that they've had within your practice, this spreadsheet can give you the breakdown of the different types of slots that they've been seeing, the minutes per appointment, the frequency of each of the appointments slot types that they've had, the total minutes dedicated to each. And then just for the trainees, this just breaks down visually how their training looks for them and whether they've had enough exposure to each of the areas that they need to have.
Definitely. So for me, looking at that, I think every GP trainer out there will want a copy of this just because of the fact that it's going to be amazing to not have to think about it and reschedule it, and it recreates it as you go along. So if people do want to check that, it's gpspreadsheets@gmail.com. But we're not done yet. We've still got more to show you as well. And this one I think is really good if you're looking for equity of how you do things in practice. And I think for many people solve a problem that they definitely have, which is figuring out the on-call rotors and things that come through in your particular practice. Shall we have a little look at that one, Davinia?
Yeah, so this one I developed really because we realised how heavy Mondays were, and one of my partners once said, oh, we could do a 3-session day, a 3-session day on call. And so it just got me thinking, actually, how easy would it be to do something like that? So this was just sort of something that I started doing just to see if I could do it, really. So it's an on-call rota planner. I've designed it to work quarterly because people come and go, or maternity leave. So it can be updated every quarter. So you've got your instructions on the first page, as you always get. Then this sheet for the staff work plans is each of the GPs and their sessional commitment. So you just write in the name of all of your GPs, their sessional commitments. So we can change this GP up here to 8 sessions, and then it will dynamically update us to the percentage responsibility of the on-call, depending on your sessional commitment. The tables here just allow for you to pick the GPs that are in on those days. And so Monday morning, Monday afternoon, because some GPs work half days, it just allows you to calculate throughout the week which GPs are in, and you can pick the GPs that are in your practice. There is a sheet just here to show if you've got clinicians on leave, and whether it's annual leave, sick leave, dependent leave, carers leave. So this is just something that you pick through. We can just add another person on here to be on leave. So if we add in Doctor number 5, they're on annual leave, and we put in the date of sort of the 1st of December 2024, and they can stay on holiday until the 31st of January 2025.
Oh, nice.
We can dream. This table is then filtered through to this sheet just here. And if you were to change the date here for November, let's say, the array would automatically update to pull through the clinicians that are away that month, and the type of leave that they have. There's also a provision for, I've loaded it so that bank holiday dates come through in light blue. So weekends are in dark grey. Obviously, we don't want anyone working on a Sunday. And then the bank holidays pull through as a light blue, so those cells should not be filled. And then what you can do is just play around with it and just put in any GP that you want for the on-call. But if they're on annual leave, it will automatically pull through as green. So we'll change Doctor 1 off there, and we'll put Doctor 5's on leave as well, but Doctor 6 isn't off, and you can just play around. Sorry, I keep using Doctor 2, but they're off, and so is Doctor 4. Let's use Doctor 6, and we'll put Doctor 6 in there as well. And then all you do is work your way down the sheet, trying to find doctors that aren't on leave. Doctor 6 is getting hammered here. And that just goes all the way down through to the end of the month. And then at the bottom here, what we have is an on-call count that's got the number of on-calls that each clinician will be doing. So you can see that Doctor 1's done 1 on-call, Doctor 6 has done 5 on-calls. And then for the next month, which will be January, you can pick any month of the year and any year up to 2027. Again, we've got New Year's Day as being highlighted in blue because that's a bank holiday date, and you can go through again and just pick who you want to have on call on those days. So you can do a split on call. Again, the clinicians on leave are pulled through here. So if you were to pick, let's say, let's try and find Doctor 6. It will highlight them in green for you so that you can then go back and find somebody else to do the on-call. And I think for me, this is sort of, it's good in real time because you're not following a formula to like try the next one, then the next one. You can, life's not that easy. You can sort of play around with it to see what works. But what you do get is the per sheet, the on-call counts, the cumulative on-calls from the month before, the percentage of the on-call that each clinician is doing, and if they are going above and beyond with their on-call commitments, the cells will highlight in red. If there's still room to give GPs a few more on-calls, it'll highlight in green. So in real time, you can play around with this to try and even out these numbers here. The same thing happens for the month number 3, which I've set at February. Again, we're not putting anybody on call on a Saturday or Sunday, but you can start, you can pick the clinicians that you want to here, and you can play around with it again. And what it will do is it will calculate cumulatively through the number of on-calls that people have had over the 3 months, the percentage of their on-call versus their responsibility, which was calculated on a previous sheet. And then it will tell you whether they're about right for where they should be, or whether there's 3 clinicians here who are doing more than everybody else.
Definitely. I can see how many practice discussions that's going to help sort out and stuff in terms of how it works. Now, Davinia's got loads more things to show. I'm going to focus on one more because I think this one's really pertinent right now, given the fact that we're in collective action. And basically, this is an enhanced service contracts calculator. Now, the reason why I think this is really powerful is the fact that it helps you figure out how much you're actually spending in terms of providing the extra services to your practice populations. And obviously, given that we're in collective action currently at the time of us filming this, I think this is a really useful thing for people to be looking at and considering. But I think there's also that understanding of how much does it actually cost for you to deliver a service? Because I don't think a lot of people know that. I know there are some calculators out there, some provided by the BMA as well, but you need to be a member of the BMA to have access to that. And actually, it's really detailed. So that gives you proper finite details. This is a really good guide I found in terms of estimating how much it costs for you to know what the service will cost and how much you will make and whether that's viable for you to continue doing so for your practice population. Do you want to go over that for us, Davinia?
Yeah, so at the beginning of the year, I sat down with all the potential enhanced services contracts and just tried to work through, okay, what's the cost here of running each of these services? And we all know that resources are getting tighter and how profitable they are. So there does need to be some background work here in terms of sort of working out how much your admin staff cost per session, and the number of admin staff that you would have in on a weekend. So let's say 2, their hourly rate, let's put £12.21 for the new minimum wage rise, the number of hours as being 6, the number of weekend clinics is 2, the number of staff. You can just see that it will calculate the costs for the staff up at the top. And then you've got your cost per vaccine, the number ordered, and then this will work out the total cost of the vaccine. And then I'm sure we all know that it's quite a complicated process in terms of claiming for each of the vaccines that are given. There's 3 different ways that we need to go through. So this spreadsheet will just work out, you put in your costs of what the vaccines have cost you, the remuneration per item, the dispensing fee per item, which is variable, and the administration, and that would be the £10.06, the number ordered, 100, and then it will automatically calculate, and then it will give you a total profit down at the bottom, depending on what the costs of the vaccine are there as well. So I've done the same for the weight management service. So if we were to say 2 weight management clinics per week, 4 patients seen per session, 8 clinics per month, the costs for staff running those clinics, and then the remuneration per patient, and then the total profits just at the end there. So really just simple calculations that you can do, and anybody could absolutely put this together. And then I've run through for the health checks as well. And then joint injections and a minor surgery. This is where I think it's sort of quite relevant to sort of have a look at the costs of each of the consumables, the time that's required for each of them versus the remuneration. So in each of these cells, you just put in the cost for your HCA, your GP, estate costs, the servicing of the equipment, consumables, injections. It will give you a total cost to the practice. And then you just put in the number of patients that's seen per clinic, the remuneration per item, and it'll work out your total profit. But obviously that's dependent on the costs up above. And I know we've played around with the minor surgery one, so we've just sort of put in some random numbers here as to sort of what the staffing costs would be. So if you were to have a HCA cost of £60, the GP cost of £100, the estate costs, the servicing costs, the consumables, the injections, it gives a total cost to the practice. And if you're seeing 6 patients per session, your remuneration's there. That's your overall profit to the practice from after taking out all of your costs. And I've done the same thing for coils, implants, and immunisations as well, which is obviously a slightly different service. But you can run searches and just see how many immunisations you're providing a month, just to keep an eye on what service provision you're providing, what you need to provide, but also, are you being remunerated? Are they being coded properly? So that's probably worth setting up a search within your practice or using Ardens, and then just having this to revisit every sort of month or so.
Definitely. And I think, there is so much in there that practices can use to try and help understand the financial aspects, the capacity aspects and stuff, and also just basically running your practice and things. And as I said, that's not even all of it, but we've covered so much. I don't think we've got time to show more, to be honest. So if people do want to find out more about how to get access to these Divinia, where's the best place for them to go?
Drop me an email on gpspreadsheets.com, and I'll happily contact you back. And I'd be quite keen to work with practices as well and see what other ideas they've got, ideas for development, and set these up so that they're used properly. As you've seen, conditional formatting can jump around. Sometimes automatic calculations turn off. So there's a few bumps in the road sometimes just getting set up with them. But once you start using them, there's a day a month that I set aside and have a look at all of this, and it's really just useful and gives a clear bit of headspace to know, okay, where are we at? What do we need to do? And if any decisions need to be made, it just feels like it's being made off sound evidence rather than this feels right for this moment in time.
And I think, like I said, it gives you that information to understand how to make those decisions moving forward. I know that there is a cost attached to these if people want to look at it, and definitely contact Divinia to find out what those are. I think they are under what people should be paying. I've told her that already, that she probably needs to charge more, but she's doing amazing work there. And the amount of effort it takes to create all this is not to be underestimated in terms of how much it will save you time by having access to these resources. So I would highly recommend the GP learners have a look at this, think about it. If you think this is going to be useful, definitely contact her, gpspreadsheets@gmail.com. As ever, we're here to help enhance things. And if you want us to come back and show you more, let me know down in the comments. I'm sure I can convince Divinia to come back at some point in the future to show us even more of the amazing things that she's got in there in terms of HR calculators, PCN calculator. Oh, it's just crazy, the list size and stuff. So do have a look, do contact her. And as always, EGPreneurs will be here to tech enhance your primary care and learning. And we'll catch you next episode. See you later.